Time now for Morning Rounds. Joining us are CBS News chief medical correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, there were lots of headlines about MERS, the virus that broke out in the Middle East, including a report of a potential infection in this country from a handshake. John, tell us about what's happening with MERS.
This is a great time to summarize since we're at the end of May. May 2nd and May 11th, the first two cases of active MERS infection came into the country, one in Indiana, one in Florida. Now, the fear was that they were going to be spreading it all over the place. And the average incubation is about 5 days, but just to be sure, it can go out to as far as 14 days. So you would think if it was being actively spread, by now, by the end of May, you would have seen a lot more infections, and we haven't. But entered this man from Illinois who met with the man from Indiana, shook his hand, had a business meeting, and then was tested afterwards. Now, he did not test positive. He tested negative for any active infection. Very important. But they did special testing to look for antibodies, which means, is there any evidence that his own immune system saw this virus and is reacting? And they tested positive. But big asterisk, the CDC on the day they announced this said, we need to do further testing, and we're going to be doing that and letting you know what it shows. So I'm still waiting to see what that further testing
But let's go back to the handshake, because I think that's what really freaked a lot of people out. How does MERS actually spread? How can we get it? And how do we know if we might actually have some of the symptoms?
Yeah, great questions. And the CDC is still trying to figure out, I spoke to them last night, exactly how it spread. They're not sure. But if it spreads like other viruses that are similar, it can be by respiratory route, so you sneeze, you have droplets, the virus is in that, and you can inhale them. Or just on surfaces, if you touch somebody's hand. If somebody sneezes into their hand, says, hi, how you doing? You touch it, and then, of course, you touch your nose or your mouth, and so people are saying, look, wash your hands, the usual stuff. Keep your hands below your neck.
So how big a concern should this be for people here in the U.S.?
I think really right now, Anthony, I don't want to downplay it too much. It's a serious virus. But right now, for this episode, I think that the risk is very, very low. And the CDC says the same thing. You would think by now we would have had a lot more cases, and we haven't seen that.
It's nice to hear, because it's certainly been in the headlines a lot. Well, researchers at Massachusetts General Hospital this week reported a link between too little sleep and too much weight in children as young as 7 years old. So, Dr. Holly, what exactly did this study look at?
Sure. Well, Vanita, this study looked at kids between the ages of 6 months and 7 years old at various points to see if at any point during that time they didn't get their recommended amount of sleep. And, of course, the recommended amount of sleep varies by age group. But if at any point they didn't get the right amount, they were more likely to be obese by age 7.
So, so there's a genuine relationship here then between lack of sleep and obesity. That's what we're...
There is. And, you know, what's interesting about this study, we've established that frequently for adults, that there is this link between not getting enough sleep and being, you know, more likely to be obese. Now, this is one of the first studies to really make that impact and show it in children. The study couldn't establish exactly why there's this link, but it might have to do with a number of things. One of the most important is that getting enough sleep helps to regulate hormones in our body that ultimately control hunger. If we don't get enough sleep, we might actually feel hungrier. And there are other concerns, like circadian rhythms also affect our metabolism. And frankly, kids who stay up late might be more likely to do late night snacking or watch TV and eat while they're watching, other things that can increase our weight.
You have little ones, I have a little one, so we both know well that sleep is like a big issue amongst moms. It's something that we actually fight about, how we get our kids to sleep and what's the best way.
Exactly. Evenings can feel like a battleground when you've got little kids at home. You know, there are a number of techniques, some very straightforward things. Make sure they're not having sugar or caffeine late at night. Try to keep TV time in the evening down. But the most important thing you can do is to set a regular bedtime and a regular routine around that bedtime, whether it's bath and books and bottle, just so they start to calm down at a specific time and are more likely to get in bed and actually fall asleep.
Good luck with that. Most of us know that high cholesterol increases the risk of heart disease, but new research suggests it can also decrease the chances of having a baby. NIH researchers studied 500 couples who were trying to have children. They found that women with the highest cholesterol levels tended to be the least likely to get pregnant. The study authors say it's possible high cholesterol has a negative effect on sex hormones like estrogen, which contribute to fertility.
Also this week, a new breast cancer controversy. Women having a mastectomy because of cancer in one breast are increasingly choosing to remove both breasts. But a new study finds the decision may have more to do with fear than survival. John, the numbers in this one were really startling. What's happening?
Well, it's not clear exactly what's happening, but I'll tell you, this is a big controversy because right now the recommendation is if you have cancer in one breast to consider mastectomy, removal of the other breast, in two main situations. One is you have genetic positivity, so BRCA gene, you have a genetic propensity to get that cancer. And the other is if you have a very strong family history of breast cancer. But in this study, they found that of the women who elected to have the prophylactic preventive mastectomy of the other normal breast, that about 70% of them did not have either of these two recommendations.
So, Holly, why do you think so many women are taking a drastic step like this when they don't actually need to?
Well, you know, I think, Anthony, it's a really interesting topic because the thought of need is different from a medical perspective and from an emotional perspective. You know, the top reason that the women who were interviewed who decided to prophylactically or preventatively take off their other breast, the top reason they cited was they just wanted to make sure they didn't get cancer in the other breast, whether it was the recurrence of their first cancer or a new cancer. But there are other concerns. If they still had a breast after having one removed, they would have to have screening, whether it's mammograms or MRIs, and deal with the inconvenience and the fear of that. And there are also cosmetic concerns. Once you've had a mastectomy and an implant on one side, it might not match up well with the natural breast on the other side. So to get a better cosmetic result, they might want to remove both breasts.
But are there any risks if you have really an unnecessary mastectomy on that other side?
You know, Vanita, absolutely there are risks. With any procedure and with any surgery, there are risks. But I feel like with this situation, it's definitely women's choice. And it's not necessarily that there's a right choice and a wrong choice. It's much more that women need to be able to make an educated choice. They have to know what they're protecting themselves from, what the reality is, and what they're getting at the end of it. And then whatever choice they make is up to them.
All right. Finally, your doctor might tell you not to play games with your blood pressure, but researchers in Boston have come up with a new online game for physicians. It helps both them and their patients. John, what's this all about?
Well, it turns out games are fun to play, and you can learn when you're doing games. And so they have an online game to learn how to manage high blood pressure. And they did a study, and they found that doctors did a little bit better when they played the game than if they just read about it online. Now, I have to say that I signed up for it last night, and I promptly got the first question wrong. Thank you very much. I think I was right, though. Anyway, I want to talk.
I've got a review book for you.
But
Don't worry about it.
I did then immediately go and click on another one. They said you could wait. No, I got to make sure I get one right, and I clicked on another. Thank God I got the second one right. But I think there's something to this. And I think the other thing that it does is it keeps coming back to you. So rather than saying, I've got to spend 1 hour and learn something, it does it in little pieces. It'll send me an email in a day or two and say, all right, here's the next question.
Dr. John LaPook, Dr. Holly Phillips, thank you both.